Imagine a future where AI, robotics, and neuroscience come together, not just to automate tasks, but to understand and support how we think, feel, and learn. A future where machines can sense a child's frustration, detect cognitive overload, and gently adapt to help them stay engaged. This is the vision behind the Neurodivergent project that I will present today. Hello everyone, I'm Dr. Diego Rezende Faria from Loughborough University, and today I will present our Neurodivergent project within the thematic of socially assistive machines, exploring multisensory AI and neuroaffective intelligence for personalized assistance. This work brings together AI, affective computing, and human-robot interaction to empower neurodiverse individuals. My research spans artificial perception, socially assistive robotics, and neuroaffective intelligence. Over the years, I've worked across the UK, Europe, and Brazil, contributing to projects on human-robot interaction, adaptive systems, and AI for health and education. My focus lies in multisensory AI. This supports adaptive interaction in child-robot and game-based learning system, particularly for children with neurodevelopment. We face an urgent societal need. 1 in 36 children is diagnosed with autism, 1 in 12 with ADHD, and 1 in 6 with a mental health condition. Our approach targets early support using accessible, adaptive, and engaging technologies. The Neurodivergent project offers a complete ecosystem to support neurodiversity. Our focus is on 3 fundamental pillars. 1, providing means to assist in early diagnosis of neurocognitive disorders and mental health. 2, neurocognitive training and emotional regulation through AI. 3, inclusion and ongoing support to ensure quality of life. Our system integrates multiple biosignals, facial expression for emotion, heart rate for stress, eye tracking for attention, speech for affect and sentiment, and brain data for cognitive state, combined to generate a real-time neuroaffective model of the child. The system is modular, capturing data through multimodal sensors, generating visual and auditory stimuli through games or robots, and feeding back adaptive support based on real-time emotion and concentration monitoring. We developed a multisensory fusion pipeline designed to detect neuroaffective patterns and real-time engagement levels. This system enables adaptive responses during interaction, modifying content and stimuli to support learning and identifying early signs of stress or disengagement. The core idea is to monitor biophysical signals while the child interacts with an adaptive game. When engagement or focus drops, and negative emotions are detected, the system responds with a target visual or auditory stimuli to help regulate emotions and re-engage the child. This isn't just reactive feedback. It's part of a neurocognitive training strategy aimed at improving emotional regulation, attention, and performance over the mid to long term. We leverage facial expression recognition, Eulerian magnification for heart rate, speech emotion and sentiment analysis, eye tracking for attention, BCI for concentration, and GANs to generate synthetic training data. We have contributed at features level design. We designed new deep learning architectures, novel fusion techniques, and generative AI for these different modules. In our first pilot with 40 children with ASD and ADHD in Brazil, we evaluated adaptive games using EEG and facial analysis. We measured emotional states, engagement levels, and acceptance, laying the groundwork for large-scale validation. Our second pilot involved robot-based interactions with 14 children with ADHD. We combined facial and speech emotion, sentiment, and usability feedback. The adaptive robot learned to mirror and support the child's engagement over time. Our system performance, both offline and real-time, is documented across several publications, spanning affective computing, child-robot interaction, and adaptive engagement in serious games. The first chart shows how adaptive games that respond to negative emotions or low engagement with visual or auditory stimuli significantly improved concentration, emotional state, and performance. The second chart compares the stimuli effectiveness. Visual cues were more effective for children with ASD, while auditory feedback worked better for those with ADHD, highlighting the value of personalized strategies. In the third chart, average engagement scores from 40 children across 3 games exceeded 3.8 out of 5 based on facial expression and EEG concentration, demonstrating strong interaction quality. The fourth graph shows over 25% improvement in emotional regulation and performance by the end of the session. In child robot interaction trials, emotion tracking via facial speech and sentiment analysis revealed predominantly positive or neutral emotional states. Feedback from children and parents showed emotional alignment through children reports slightly higher stress. Lastly, gender difference emerged. Females showed lower engagement and stayed farther from the robot, while males demonstrate higher engagement and closer proximity. Our goal is clear: use AI not just to assist, but to empower. We envision a world where neurodiversity is embraced as a superpower and where personalized assistive technologies are accessible to all. Thank you very much.